Hi, this is Dr. Clive Gallagher. I am a plastic and reconstructive surgeon based in Indianapolis, Indiana. So this video is about breast reduction surgery. This is one of the most common procedures I do here in Indiana, and I want to talk about firstly why a patient might undergo a breast reduction. One of the big questions my patients always have for me is, will it be paid by my insurance? And then what the procedure involves, and to tell you a little bit more about your appearance afterwards. And then we're going to take a look at some of my patients' previous results. So first of all, who needs a breast reduction? So technically speaking, in order to do a breast reduction through your insurance, we do have to take a certain amount of the breast weight off. Depending on your height and weight, otherwise, usually that number is greater than 500 grams. So 2.2 pounds in a kilogram, and that's about half a kilogram, so you can do the math there. So in order for an insurance company to approve this surgery, there are a few requirements a patient will have to meet. So the first one is a patient will have to have back pain, neck pain, shoulder pain, and problems which we know are attributable to the large breasts, or what the medical term is macromastia. Another criteria is that the patient suffers from rashes underneath her breasts, which have to be treated with antifungal medications. The name for this rash is Candida intertrigo, and it's super helpful if the patient's primary care doctor has documented this before, so that we can say, hey, this patient has an ongoing problem with this issue. In some cases, some insurance companies will require that a patient try other things before the breast reduction. So it's oftentimes very useful to document if the patient has tried weight loss, if there's been any change in the bra size, if the patient has tried different specialized bras, and if the patient has undergone physical therapy to help with their posture and possibly alleviate their back pain. So it's very useful when you go to see your plastic surgeon if we can document all that. This really helps our case with the insurance company. So then how it works is usually once we determine that the patient is otherwise a good candidate for surgery, we'll go ahead and write a letter documenting all these different things to the patient's insurance company, along with the patient's photographs, send it in to see if they will approve it. If a patient hasn't had a mammogram and is over the age of 35 and hasn't had a mammogram in the past year, we will check one of those also prior to surgery. The next thing we spend a lot of time talking about with our patients is what the patient's goal is and what size they want to be. So my patients kind of fall into two broad categories. By far the most common category is the patient who just wants relief from her symptoms, but at the same time wants a good aesthetic breast that is going to fit her frame. However, we do have some patients that say, I'm absolutely done with these things, make me as small as you possibly can. I don't care if I'm flat-chested. And some of our older ladies fall into this category. So we really try to listen to the patient and determine what their goals are. So usually the most common technique I use, depending on the patient's desires, so let's say that most common group of patients we have who wants a better appearance to their breast and something that really fits the body, in addition to helping with the pain and rashes and other symptoms they're having. So we absolutely can achieve that, and how we do that is when you look at the breast, in a very large breast, usually we have a lot of excess tissue out to the side and down low where we don't need it. So what I do, my approach, which I learned in Sydney, Australia, when I traveled over there was or is to maintain the breast tissue where we want it. So most patients like cleavage and they like having perky breasts. So what I do is I use what's called a superior medial pedicle technique in most cases, and what this means is we're preserving the nipple, obviously, on its blood supply, but the tissue that's preserving that is the middle and superior or high up breast tissue, while we can get rid of that excess side boob that nobody needs. So in this way, we reshape the breast, and also, most patients with very large breasts will have excess skin as well. So we need to tighten in that breast pocket and recreate the shape in order to lift the breast up on the chest and get a perkier, much more prettier appearing breast. And so how we do this is with an anchor scar, what's called a WISE pattern. So if you think of it, it's like an upside down anchor. So there's a circle around the nipple itself, then an incision down the middle, and then in the fold underneath the breast is hidden another incision. And this way we're able to pull everything together so the breast projects more and is a lot more perkier and higher on the chest. One thing to note is at the time of surgery, we always over project and overlift the breast, and because in the weeks following your surgery, the breast will settle into its new position. So we kind of overlift it at first so that it's perfect once it's beginning to heal and settle into its proper position. So typically, breast reduction surgery, you come into hospital, healthy young people, if we do it early in the day, can go home the same day of surgery, certainly. I never use drains for this procedure. It's well proven in the literature that putting drains in does no good, so we avoid that. If a patient's a little bit older, we'll do an overnight stay, and most patients go back to work 1 week at the very earliest, more commonly 2 weeks. And if you go over to our website, you'll see some before and after pictures.